On behalf of the National Family Drug Court Technical Assistance and Training Program, we would like to welcome you to the Learning Academy webinar, Is Your FDC Built to Last? The Importance of Real Sustainability Planning. I would now like to introduce Phil Breitenbuscher, the Director of the Family Drug Court Training and Technical Assistance Program at Children and Family Futures.
Thank you very much, Alexis. And thank you all for joining us today. We appreciate your attendance and the time you're taking out of your day to attend this webinar, and we hope that it's helpful for you. Let me first start out by thanking the Office of Juvenile Justice and Delinquency Prevention for supporting today's program and for supporting the Family Drug Court Technical Assistance and Training Program. I'd like to also thank our speakers on today's webinar, which will be Stead Gardner, who will provide some opening remarks and a national overview and some key features of sustainability planning. Stead Gardner is the President of Children and Family Futures. He served as the Director of the Center for Collaboration for the Children at California State University, Fullerton from 1991 to 2001. Mr. Gardner has served as a staff member of the White House Domestic Council, Deputy Assistant Secretary of the U.S. Department of Health, Education, and Welfare. He graduated from Occidental College and was awarded a master's degree in public policy from Princeton University. So thanks, Ed, for joining us today. I also like to welcome from the city of Baltimore, Maryland, Jocelyn Gaynor. Jocelyn's currently serving as Executive Director of the Family Recovery Program, Inc. She brings more than 23 years of experience in the field of addictions and recovery. She has worked with the Family Recovery Program since 2007, during which time she's seen the program grow and received multiple awards and national recognition. Jocelyn has earned her undergraduate degree in psychology from the University of Virginia and her graduate degree from Towson University, and is currently pursuing her doctorate at Morgan State University. So thank you, Jocelyn, for joining us as well. You'll hear from Jocelyn a little bit later on today. So let me just start out, and again, I like to put all of these webinars into perspective and into the lens of our overall Learning Academy. As many of you know, as many of you have participated in multiple webinars, you know that this is actually our fourth, what we call learning community. The first three were called the planning community, early implementation community, and enhanced community. And I think that we really recognize and want to stress to you that none of these components can be implemented in isolation or in a silo. As you'll hear, that to be effective in sustainability planning, you must also be effective with information sharing. You must also be effective in showing good outcomes, having shared outcomes across systems, which means that you have to also have good practices, which we talked about in other modules of this webinar. This year, our Learning Academy, our Learning Community is focused on advanced practice. You see on your screen now the 7 webinars that we've done previously this year. This is our last webinar for 2012. We will be having a Family Drug Court Learning Academy in 2013, so please look for those topics probably in late December. Today's webinar will focus on sustainability, as Alexis already stated. So tell us about your current status on sustainability planning. Have you already begun work on this? Have you had any discussions? Are you in the initial stages? Are you engaged in active planning, or you're not certain where your drug court is? We'll give you a few seconds to respond to this poll. Okay, we're going to go ahead and close that out. And we see that the majority of you are kind of right in the middle there. About 60% of you have an initial discussions, and about a quarter of you are actively planning and have a formal plan. So that's fantastic. So hopefully we'll address those topics. And some of you that are uncertain, hopefully we'll give you some tools that you can go back to your team and ask some good questions. So now I'd like to turn it over to the President of Children and Family Futures, Mr. Stead Gardner.
Thanks very much, Phil, and thank all of you for your interest in this topic. We're hopeful that we can give you a good sense of where your colleagues are and some advice that may be useful as you move through this issue. It would not make any sense at all to launch into a conversation about future funding without taking stock of the fiscal environment that you're living in. And we want to be realistic about that, but also highlight some opportunities in the midst of what is obviously, in most of your states, a very tight fiscal situation. First, it's obvious that the deficits in state and local government, long-term deficits in spending, debt and pension deficits all make for the most part, state and local finance very tight at this point. The combination of all we're hearing about the fiscal cliff and the uncertainties about Congress, the possibility of further cuts in discretionary programs, all of that is a part of the reality. Some of you have already been affected by cuts not only in family drug courts that are funded at the state level, but in some of your partner agencies, child welfare treatment, and other partner agencies. At the same time, however, we want to underscore that family drug courts and veterans treatment courts and home visiting are three areas that have been generally immune from federal cuts and, in fact, have been, in all three cases, areas where funding has been expanded. So that's important to recognize. It's also important to recognize that we're going through the largest change in financing drug and alcohol treatment and mental health treatment capacity that we've ever seen in history. That leads to a lot of uncertainty about the Affordable Care Act and health exchanges in some of your states. But the combination, we think, of the new parity legislation, which will affect private and some state health exchange coverage, and the managed care environment, the greater emphasis on primary care that some of you have taken advantage of, all those seem to us to be opportunities for strengthening the links to treatment. There are some ongoing legal conflicts over the federal role, those have clarified somewhat recently. There are new governors, obviously, who will be sorting out what's going on, and the child welfare system has been affected by changes in the entries to foster care and changes in the increases in neglect cases in a number of states. So the question becomes whether your FDC has an infrastructure in place that can take on these times. Have you begun to lay the groundwork to make the case for either new or redirected funding next year and in 2014? Our advice is, and we've said this over and over in a number of different ways, not to wait until the last 6 months of the project to do serious sustainability planning. The more time you invest at the front of that process, the better it will pay off toward the end. We want to underscore in particular two major changes, both in the child welfare system and that will affect the behavioral health, the mental health, and drug and alcohol system, and the Title IV waiver, which emphasizes the savings that may be possible by greater flexibility in child welfare spending. Those of you from the court system need to be in conversations to find out whether your state or county and county-operated systems is one of those that will be seeking for a flexibility. Affordable care, we've already mentioned, and there's a presentation that will be helpful to you on that issue. FDCs are funded in a number of different ways. That's the good news, and it's also the confusing news. Some of you are funded under SAMHSA from the Center for Substance Abuse Treatment, some of you from the Department of Justice, OJJDP, the Administration on Children and Families through the Children's Bureau Regional Partnership Grant funds a number of programs around the country. In some of your states, there is state funding and even city and county funding in a few cases, and substantial private foundation and in-kind funding. All of that expands the opportunities for funding, but it makes it critical to know about more than one funding source. If you're funded from one of these, knowing more about the others and how the cycles of funding operate and what the timelines are becomes critical. We also want to emphasize the difference between millions and billions. That may seem obvious, but it's important to emphasize that federal direct funding for family drug courts is at the present time in the current fiscal year about $19 million. If you look at all the other sources that some family drug courts have been able to tap into, and this doesn't address directly the other federal block grant funding, there's $13.6 billion in those funding streams. Another way of making the same point is with a graphic that shows in a community above the surface of the community the highly visible pilots, demonstration projects, and grant-funded projects. And those are how many of you are funded at the present time. Good to have that external funding coming in, highly visible, but it's also important to recognize that beneath the surface of your community, in some ways almost entirely invisible, are the real resources from the welfare system, from Medi-Cal, from housing, the police department, schools, hospitals. These are the real resources. And so when we say millions is less important than billions, it's making sure that you have a redirection agenda. Those resources are already in your community. And if you're thinking at this point, well, there's no way we could get access to those funds, the question then becomes, would you rather just work above the surface on the smaller grants that are available from external sources, or make the case for redirection within your own community? If your program is successful, you can save money for the welfare system, for the Medicaid system, for repeat entries to hospitals in some cases, for mental health, and so on. If you work with younger children and you get them to attend school, in some school districts that saves schools money on average daily attendance. So understanding who you're saving money for will be one of the things that we emphasize in sustainability planning as you look at where the real money is. Evaluation is critical to making your case. Some of you have elaborate evaluation systems. Some of you do a good job of counting the clients who come in the door. And in between are where most of you are with some real challenges to answering the question, how do we know that your family drug court works? Measured against what baselines? Measured against what goals? Do you save money? Who do you save money for? Are you able to look at costs? We'll talk about that in more detail. If you're effective, should you be expanded? If you're doing a good job for 30 clients and there's 300 clients in your community that need it, how do you get to the next 30? If you're better than the way they're handling most of those 300 clients today. And that, of course, makes it critical to know what the scale of your FDC is. Some of you are small FDCs, but you may represent as much as 25% or even more of the total number of clients in your community who need that service. Knowing what percent, what your, in the private sector we'd call that market share, what your market share is an important question to be able to answer and not to be so insulated and focusing only on your project that you don't think about the rest of the system. That's part of making the case, is understanding how you relate to the larger system, and that's about evaluation. Outcomes and effectiveness will enable you to answer the question, is there anybody in the partner agencies or in your community or state who cares enough about the results of your innovation to be willing to pay for part of it? Not to pick up the whole thing, but to pay for part of it. Which outcomes would be most credible? If you're saving out-of-home care money for the child welfare system, and you're in a state where the county and the state, as well as the federal government, are funding child welfare, you need to know that you're saving money for that system. Is your information system strong enough to capture that data and make that case? If not, investing in the core of your information system may be the best way to have a payoff later on in actual sustainability of your program. We talk about a family drug court dashboard, ways in which the performance of your program can be measured with concrete indicators, and it's important to know what those consist of. In different communities, the list will be different, but in most cases, re-entry to foster care, how long it takes to reunify families, prevention of substance-exposed newborns if you're working with pregnant moms and younger children, access to treatment. Are you able to get clients into the treatment system faster than those clients who don't have the benefit of going through a family drug court? And are you connected to support services, to housing, to income support, to employment in ways that those clients who don't have benefits of a family drug court can achieve? Selecting the outcomes that have the biggest payoff for your partners is a critical part of evaluation and information system building. And that's a part of sustainability planning as well. We talk about show and tell. We need to show that your program works, that it saves money, that you're working in partnerships that are uncommon. Most of us in hard times tend to retreat to a focus on our own agency and our own project. If you can show that you're working across agencies and serving clients that you share with other agencies that you need to partner with, your case may be stronger for refunding. We also need to tell, and here we say, to strip away all the verbiage, it's about numbers and stories. You have to be able to present the data the solid information that's drawn from your information and evaluation systems about the success of your program. And you have to have stories, anecdotes about real people, which can communicate much more effectively than long pages of narrative written in the acronyms that we sometimes use when we communicate with each other. You've got to have a marketing perspective. It may be helpful to find a member of an advisory board or someone in your community who lives in the world of marketing, both social marketing and commercial marketing, who can help you describe your program in clear and persuasive language. That's the tell part of the equation. It's also important in telling your story to make sure that you test what stories are most effective with policy leaders. Talk to your city council, your county commissioners, your state legislators. Bring them in to see your program in operation and see which data and which stories are most effective. These are 5 different themes that we set forth in more detail in other materials on the website. You can make the case by talking about how prevalent substance abuse is in your caseload, by talking about developmental effects on younger children who you can keep out of the drug and alcohol system if you're working with their parents, the intergenerational effect. A family drug court is a 2-generation program by definition. It has an effect on children as well as parents. And by making the case based on outcomes and cost savings. You have to test which of those are the strongest and most persuasive. There is, we want to emphasize, no single model that you can plug and play, that you can pull off the shelf that will work for all sites. That's why we urge you to test these themes and ideas, test the data and the stories with the policy leaders that you're ultimately going to have to sell. It's always helpful, we've found, to sit down with somebody who wears a budget hat and have a preliminary conversation, not the final negotiation, but a preliminary discussion in which you're basically saying to them, is this persuasive? Would this help you make the case with the budget director and ultimately with the elected officials? That means you can customize sustainability and not use an off-the-shelf model. Cost analysis, we've referred to in a number of different ways, and we want to distinguish between 3 different kinds of cost analysis, some of which can get very expensive. We're not talking about the kind of cost analysis that can be published in a referee journal. We're talking about knowing more than most family drug courts, and in fact more than most human service projects know about what their programs cost. You'd be surprised how often we go out to site visits and ask people about the cost of their program and how that compares with the cost of the programs for clients who don't go through family drug courts. Those are not numbers that are readily available, and they can be very important. We are available to provide assistance in cost analysis. We and our colleagues at NPC, another evaluation organization based in Portland, have done work around the country with some of your sites, perhaps, and we're delighted to help with further emphasis on cost analysis. In doing that kind of work, you have to break down your own budget. You have to deconstruct your entire budget. How much does the program coordination element, the case management, the actual treatment itself, liaison from the child welfare system, the time of the judicial staff, how much are each of those elements making up? Your budget may say staff, consultants, travel, and what you've got to do is break down your budget in a different way to look at the different components. When the federal funding runs out, if you're trying to get case management or the liaison from child welfare or the children's services element paid for, you need to know what that element costs, and that kind of budget analysis is crucial. Every FDC, whatever the details of its information system, needs to know how its budget breaks down according to the elements of its program. Any funder who is serious will ask you what it costs, will ask you how much more does it cost than the way we usually do things before the FDC, and why should we pay more if it costs more? In some cases, what you've done is to add case managers or services to children or other elements that enrich the program, that make sure that clients are engaged for longer, that clients are more likely to come into the system, that clients are more likely to continue, and those pieces cost money. You need to know in talking with funders how much more it costs and what longer-term benefits result. That's important, and it also underscores how much you need to know about the cost of the current system, not just your project, but the system that you operate in parallel to. Getting to the next level of costs can be very detailed. You need to distinguish between one-time startup costs and costs that you incur every year. You need to distinguish between harder to serve clients, which may require more attention, more time, smaller caseloads. You need to talk about what costs can be borne by other agencies or by clients' entitlements. In some cases, when child care is essential, the local or state or county child care agencies or Head Starts have been willing to step up and help family drug courts. So it's not just what's in your budget, it's the help you're getting from the budgets of other agencies as you operate the family drug court. Knowing the baseline costs, that's a phrase that we use when we get to the question of how much the existing system costs. And again, as we've already said, the base costs of business as usual and the costs of your model are usually different. You need to know what that difference is. You may go to the child welfare system and say, what is an average case cost in family reunification, and get a sort of blank stare. Don't give up. You may get a similar reaction from the treatment system. Don't give up. Offer to help them construct that. The initial arithmetic of the total cost of the system and the total number of clients can be very deceptive, but that's a starting point for a conversation. If you've got $250,000 and 25 clients, saying it's $10,000 per client may obscure some of your costs, but it's the beginning of a conversation in which you want to make sure that you know what the answer is to the per client cost. Being small isn't automatically a disadvantage if you're a significant percentage of total need, if you're working with priority groups, if you're saving money for hospital, special education, or failed adoption and foster placements. You need to know whether you've got 20 or 15 or 25 clients, how that relates and which target groups you've selected. The target groups that you may have selected may be a much larger percentage of those particular children or families than any other agency in your community is taking on. You need to know that. Cost offsets is explaining the ways in which public safety and court and corrections costs, each of these in an evaluation done by ourselves, by NPC, or by the stronger family drug courts, each of these indicators has been documented as a cost offset of a family drug court. Look at each of these and others that you may want to cite as a way of making your case with the budget folks. Transactional costs, I've mentioned NPC research. We have great admiration for the work that they've done with family and adult courts across the country, and that's one method that you can look into if it makes sense. It's a more detailed way of looking at the actual costs of each transaction in a family drug court. And those are the details of the transactional drug costs. This, again, gives you a sense of how you're going to need to break down your budget in doing sustainability planning into the actual number of days in each part of the system, the cost of drug tests, and the average number of transactions per client. That's a level of detail you might not all get to, but if you do, you're going to be much better armed in conversations about future funding than a site that just goes in with a few numbers about intake and cost. The wicked arithmetic problem is what we refer to when we say 25 clients, $250,000, $10,000 per client. If the system today thinks that it's spending $1,000 per client on treatment, and your numbers initially look like you're spending $10,000, you're in trouble. And so knowing what those benchmark costs actually are is a way of protecting yourself against the simple division. I'm a former elected official, and that gives me the standing perhaps to say that elected officials aren't always good at higher math, and they may do exactly that kind of wicked arithmetic in trying to say, boy, you're too expensive, you're a Cadillac model. Well, if the Cadillac drives better and lasts longer and saves gas compared to a beat-up junker, it's a cheaper car, and that's the case you need to make. So in thinking about cost analysis, it's also important to note whether you actually move the needle. For those of you who know the child welfare system, you know that the Child and Family Service Review that's done periodically by the federal government looks at reunifications overall, looks at a number of measures, and asks whether the county or the state is making a difference. Does your project make a difference in moving the needle in any of those child welfare outcomes or treatment outcomes in the treatment system? Sustainability planning ultimately is about collaboration. Will people share the data that you need to do costs across agencies, and then will they ultimately share costs? It's not going off in a corner and saying to someone who may be the development manager or the CFO, you go do a sustainability plan. It is an ongoing conversation with other partners who may not yet have money in the table, but who may be potentially willing to fund you if you can make the case with them that you save them money and that you understand your costs and theirs well. That is an interagency conversation. It takes multiple encounters, and it can't be done by a single person off in a room. You'll be asked, again, as I've already indicated, why your costs are so high. That's an important question, but you've got to then be able to quickly answer because our results are so effective. And it's also important to recognize that short-term grant funding may not be as flexible or sustainable as the long-term funding. Again, the difference between millions and billions, aiming your sustainability efforts at the pots of money that represent billions may be more effective than relying on grant after grant after grant. Competition for grants, as you all know well, is becoming more and more intense, and that's important to recognize. So we're going to wrap with some questions about sustainability planning. Do you know the critical components that drive the outcomes you're achieving? What are the critical comments in your family drug court that help you achieve positive outcomes? Which can you expand without additional funding because you've learned to work in that arena effectively? And which of the critical components may require additional funding? Case management, the substance abuse specialist, early screening, services to children are examples that we've heard repeatedly, and they come up in some of your questions in advance of this webinar. Those are some of the questions that we get in terms of critical components. Okay, I'm going to turn it back.
Great. Thank you, Sid, for that national perspective on family drug court sustainability. Next, we want to have another polling question, and we'd like to know, what is your FDC's biggest barrier to sustainability? You can select from the responses below, from one being lack of knowledge about available funding streams. Maybe you do not know which key stakeholders to engage in discussions. Is there a lack of knowledge about current substance abuse and child welfare services resources in your region? Maybe there's no data to identify effective program or key opponents, or maybe you're not certain on what to sustain. We'll give you 3 seconds to go ahead and respond to this. Okay, great. It looks like the majority of you have responded. So thank you for your responses, and it appears that the majority of you feel that there's a lack of knowledge about available funding streams, and there's a few of you that are also uncertain on what exactly to sustain. So next we want to hear from the Director of the Family Drug Court Training and Technical Assistance Program, Phil Breitenbuscher.
Thanks, Alexis, very much. So let's talk. So I'm going to come back to the funding streams that are available. I think each of these I'm going to touch on a little bit in just these kind of comments that I'll make before I turn it over to Jocelyn. But knowing those available funding streams in your communities is just so critical and important. We can't stress that enough. And I want to talk a little bit about that. And we're going to show an example here of what Sid was talking about and breaking down those funding streams and breaking down those critical components in your family drug courts. We know that for one of the critical components for most family drug courts, if not all family drug courts, is that key case manager position, the collaborator. And oftentimes we see, and you'll hear our director, Nancy Young, say, oftentimes collaborators are always the first to be cut. When you're looking in tough budget times and they think of a person as additional or extra, or they're just the one that's bringing people together, they're not providing the real service. They're the most vulnerable sometimes. And in our family drug court world, this person may be the most critical component that you have. This is the person that's doing the initial assessment. They're doing that engagement work. They're doing the ongoing retention work that you need to keep these people your parents in treatment. They're keeping the court informed. They're doing your drug testing, your monitoring. They're helping with your evaluation. You know what they're doing, and unfortunately, they're sometimes the most vulnerable. So we wanted to give you an example of how you might take apart your overall family drug court budget and look at just one component of that budget, which is maybe your case management component. And the reason I did pick this is because we've probably over the last 3 or 4 months have received just an overwhelming, numerous calls about how do we keep this position funded after our grant. And so I thought this would be a great opportunity to take apart and give you one idea. This is just one component. Of course, there's many different ways to think about sustaining case managers, for instance, or your overall program. But here's one way to think about sustaining this critical component of your family drug court. I'm going to talk about it in 3 different steps. One, you really need to know what the job description is. I think there's probably in that also what is the cost of this position. So what is the job description? What's the cost of that job? What are the funding sources available in your community? Step 2. And in step 3, what is the best match? Who has the money to fund this? So let's talk about this a little bit. So again, you take apart all those different program components, and you can do the same model with any one of these types of components that are listed here on your screen, plus the many more. But knowing which ones are most critical to sustain is very important. So knowing your outcomes, what are the most critical components to keeping your drug court alive, and starting with those first. So let's take case management. First, what's the job description? I want to say also that many of you have different names for this position. This probably goes without saying, but there's the term substance abuse specialist, case manager, recovery support specialist, recovery resource specialist, service coordinator, parent recovery specialist. There's many different terms that we might be able to use for this particular position. But break down, what are they doing? Are they a formal liaison, a treatment broker, an advisor, etc.? For instance, a substance abuse specialist, they monitor the, this is important when you go to funders that you're able to really articulate their job description, because each one of these funding sources that I'm going to talk about later, they have parameters in which you can bill to their funding source based on the project or the service that is being provided to these parents or children. So knowing that they're monitoring participant progress and compliance, facilitating access to treatment, linking participants with support, entering case data, communicating with the team, doing educational support, providing prevention services. We can go on and on. Knowing what those services are, being real clear about that, you go to sit down with your fiscal manager, is going to be very important for you to make sure you have this list written out in front of you. So then we want to take a look at and do an inventory of all the funding sources that are available in your community. As Sid laid out, there is that above source funding that right now your case manager is funded by this grant. The grant ends next year or the year after. Start now. Let's start looking at the total funding sources that might be available. And this is going to take collaboration. This takes building trust and relationships with all of your partners at the team, because honestly, some people may be afraid that if they talk to you about potential funding opportunities, that they're somehow guaranteeing that that funding is available to you. You don't want to start the conversation there. You want to start the conversation with, we just want to see what funding might be available to fund a case manager. I want to point to this resource. I'm going to go through a couple resources here and point out to you this resource that was published in 2008 by CSAT. Broke down all the federal funding sources for funding family-centered treatment for women with substance use disorders. Most of your family drug court families fit into this category, so this is a very good resource for you. So looking at funding substance abuse treatment and related support services for adults, aka your mothers and fathers, you see over here to the left of my screen the multiple funding sources. And if we look right here, so in this program or this publication, all these different sources, so your outreach, your screening, you're doing your assessments, counseling, crisis intervention, etc. And then over here we have your case management. Lots of these funding sources can fund case management. We want to be able to list these out. You're just doing an inventory to start. Here's another set of those funding sources. listing out, getting an inventory of your community, and these are just federal funds. You also want to look at your state funds. Are there county funds or local jurisdiction funds that are also available to you? Getting this inventory built is your first step. This is for children and parents, allowable services. So now thinking about what are the services that will just fund children versus just fund case management for parents is also important. So going through, getting that inventory of resources is your first step. Breaking that down. What are the treatment funding sources that fund case management? What are the child welfare funds that fund case management? Are there court funds that you can look at? Are there CIP funds from your state office? Are there restitution funds, administrative funds? Some of the work that a case manager does might qualify as administrative for the court program. Once you've done that inventory, you've listed out all those resources, you want to take a stock of all of those options. And then who are your best bets? Who are the folks that you can begin to have a conversation with, and who can you show are you're providing outcomes to, or maybe even providing cost savings to? You can make a case that some of those funds they're using out of all those categories could be sliced off and be funding some of your case management funds. So you have your list here of all the funding sources. You'll have a budget here. When you get down to the most states or large jurisdictions, these numbers will be in the hundreds of millions, if not close to $1 billion. I mean, it will be definitely in the hundreds of millions of dollars for most states and large counties, very easily. Obviously, you're not asking for, and most of those dollars will be accounted for, and you might even be told right away, oh, for instance, all our Title IV dollars are maxed right now. In fact, we're using attrition to cut funds because those funds are being maxed out. Well, sometimes there's mid-year savings. You just want to know what the funding sources are and then begin those conversations. So let's look at, once you have those funding sources broken down and you're working as a team, how some sites have looked at funding this position. This scenario right here, treatment said, you know what, we have extra funds in these 3 funding sources. We can group these funds together and we can get you $50,000 to fund the case manager. Obviously, we know this is very low for a fully funded case management position, but we're just trying to make the case here. So in one case, you might have just treatment saying that they have some extra funds. In another case, it may be a true collaborative effort in which you have this person time studying to multiple funding sources across multiple agencies to get them to that $50,000. Again, this is going to involve your accounting staff. How do you time study this way, and how do you get those billings submitted in a timely way and recouping those funds? It's not an easy task at all. We're not assuming that it is easy, and that's why you want to have these conversations sooner than later. When you blend funds like this, you're just asking for a much smaller amount of multiple funding streams. And so I'm not asking child welfare to fund the full position, maybe just half the position, and maybe treatment's taken on half, and maybe court's giving me a slice. You'll have to have these discussions in your own community. We took a look at another resource that was published not too long ago from CSAT, Substance Abuse Specialists and Child Welfare Agencies and Dependency Courts, and we looked at how these substance abuse specialists were funded across all these different funding sources. You'll see that some were treatment-only funded, and some were just child welfare funded, and then there were these other 3 that were blended funding. So this is happening across the country. This is just an example of 7 sites. It says 6 and 7. 7 sites across the country that we looked at for this publication, and where they've found a way to make it work over multiple funding streams across multiple agencies. So that's one idea and one way to look at how you break down each component of your budget, how you can do an inventory. We're a couple resources on looking at what are the federal resources. You can probably find, we can help you find what are your state resources, maybe there's local resources, getting that inventory done, beginning those conversations early so that you can keep those critical positions funded. And at this point, I would like now to turn it over to Jocelyn Gaynors from the Family Recovery Program. Jocelyn?
Hello. Thanks, Phil and Sid and Alexis, for allowing me the opportunity to share some information today with you about my program. The work that you all do is very important to all of us. First, I'd like to just say good morning to some and good afternoon to others. As previously stated, my name is Jocelyn Gaynors, and I'm the Executive Director of the Family Recovery Program located in Baltimore, Maryland. Today, I'm going to be introducing you to our program and sharing some lessons learned along the way. All the pictures that you're going to see today are actual clients of our program, and they've given us permission to have those pictures highlighted today. Today, I will be spending a little bit of time talking about some of the goals of our program, some of the services that we offer, some of the challenges and the opportunities that we face, and how our partnerships have helped with our funding and our sustainability. The goals of the Family Recovery Program are primarily to reduce children's stay in foster care by reducing the substance use of their parents. We actually accomplish that through excellent partnerships and interagency collaboration. The Family Recovery Program was actually created in 2005 after a group of individuals here in Baltimore visited the San Diego SARMS program. After that visit, a decision was made to modify the program slightly and to begin a pilot program here in Baltimore. We began with 2 case managers and Judge Martin Welsh presiding. We decided that the program would be voluntary. It would also be 1 year in length. And we looked around for lots of funding, but came across these few here that would be willing to fund us for our first few years of service. The Family Recovery Program serves children who have parents that have abused substances throughout their lives, and those children generally are ages 0 to 5, and they must have been removed by the Baltimore City Department of Social Services. That's our local child serving agency. Those children must have been in care for at least 1 night, and they either have to be drug exposed or neglected. The parents can be referred into our program throughout the many hearings that are held, the preliminary hearing, the adjudicatory hearing, the 10-month and the permanency planning hearing. We also have the opportunity to order parents in at the dispositional hearing. What do we provide? The Family Recovery Program is a very comprehensive program and provides lots and lots of services for our clients. First, we have intensive substance abuse case management. I have a staff of 5 case managers that work very hard to help determine the proper level of care for all clients, and then they actually monitor the client's progress in treatment as well as housing and other needs that arise. We also have 24-hour drug treatment referral and placement. What that means is that when a client comes into our office, they have to be placed in drug treatment within 24 hours. We have on-demand treatment here in Baltimore, and it is very important when a client is ready to go into treatment that we have a treatment slot available. The Family Recovery Program actually has funds that are separate from our other funds to allow immediate placement of clients in treatment. We also have immediate supportive housing through local recovery providers. We work with an organization called BASH, which stands for the Baltimore Area Association of Supportive Housing, and they have about 65 houses throughout Baltimore and the state of Maryland where our clients can go for housing on demand. Any client that comes into the office today can be housed tonight, whether they be an individual or they be a family. Also here we have on-site licensed mental health clinicians, a psychiatrist, and a nurse. We don't provide those services directly ourselves. We partner with another agency. We allow them to use our office space for the cost of them seeing the clients. We also have transportation assistance through a local cab company, and we provide our clients bus tokens as needed. To assist with all things mental health, we do provide help with medications. In the state of Maryland, clients can apply for PAC, but the wait period for the PAC insurance is about 90 days, and many of our clients are given prescriptions that have to be filled immediately. So we do have a partnership with a local pharmacy who's able to fill those prescriptions the same day. We also have on-site evidence-based parenting programs, Celebrating Families, that meets once a week for 16 weeks, and our clients are enjoying being able to come to the Family Recovery Program to actually have their parenting, which is very often a part of their DSS programming. We have random drug testing on site. We have an incentive store that we've created to help our clients get excited about being in treatment, and we have a clothing closet. We make lots of referrals to outside agencies. We create comprehensive reports. We have one judge, the same judge every week, Judge Robert Kershaw, who hears all of our cases, and he works very intensively with us to try to create progress for our clients. We have an alumni group on site. They meet monthly, and other supportive groups on site. Some of those meet weekly. We also have peer recovery advocates. Those are individuals who come to us to volunteer to kind of give back to the program, but they're actually trained in the peer recovery coach model. And the last thing that we provide is opportunity. How do we do this? Well, first of all, we have willing participants. They're not all willing when we first get them, but by the time we work with them for a little while, they become willing. We have a very dedicated and patient staff. We have individuals here who are in recovery themselves and those who aren't, and everyone brings their heart with them when they come to work. We have very responsive programming. We hear the client's needs, and we try to determine how can we change our program to make sure that we're responsive to those needs. We have a very informed local community. Many members of the community are aware of the Family Recovery Program and the good work that we do in serving the clients. We have an informed court system. We have a system that is very aware of the Family Recovery Program and all things positive about our system. We have solid funding. I'll talk a little bit more about that later. And lastly, partnerships, partnerships, partnerships. That's the only way we're able to have success here at the Family Recovery Program. Some of the challenges that we face are referrals. As you all know, as Sid talked about earlier today, numbers are down. That means very often that we are working with clients who have more challenges, but that just gives us more opportunity to create change in their lives. Funding can be a challenge, and there are also some client barriers to reunification. Here in Maryland, we have issues of housing, we have high unpaid utility bills, we have extensive legal history, and we have relapse as a problem for our clients. For every challenge, however, there's an opportunity. So when it comes to referrals, what we decided to do here at the Family Recovery Program is to find ways for creative programming. I'll talk a little bit more about that later. We also have a creative financing mechanism called the Maryland Opportunity Compact. And when it comes to our client barriers to reunification, we have created some intensified community partnerships to address those issues. Our creative programming starts with our assessments and drug treatment referrals, as I said earlier, which occur within 24 hours of referral to our program. Many places do not offer those services, and we understand the importance of catching clients when they are in their moment of need. In addition to that, we have very intensive engagement and re-engagement strategies. When our clients are first invited to come and join the Family Recovery Program, they are assigned a peer recovery advocate. Again, that is an individual that is a volunteer that more than likely has been a part of our program, and they've actually been through the year-long program, and they understand what it takes to have success. So they're given a buddy, and that buddy is allowed to attend court with them, go to different hearings with them, come to the Family Recovery Program, and just be comfortable. In addition to that, we actually have a re-engagement specialist on staff whose main job is to go out into the community to try and locate individuals who haven't been showing up, people who the case managers are having difficulty contacting. So those intensive engagement and re-engagement strategies really create a solid foundation for us. Again, I spoke already about the peer recovery advocate, an excellent addition to our program. We also have very positive reinforcement. Our judge spends a lot of time in the courtroom off the bench. He really is attentive to the needs of the client, and he gives a lot of hugs and handshakes and gives out a lot of vouchers to really encourage our clients to try and make changes in their life. In addition to that, we have some tracks that we've created recently for clients who only use marijuana. We also have tracks for clients who need a second chance after their years ended. And just recently, we created a track for clients who are not involved in court, where we do actually some preventive work with the Department of Social Services for those clients that they are concerned about who may end up in the Family Recovery Program. The Maryland Opportunity Compact is a very, very creative way that we have come up for funding. It is not something that we're actually using, but it is a model that is in place here in Maryland and here in the city of Baltimore to encourage the Family Recovery Program to do excellent work. What it does is it actually, as I have listed on the slide here, it does create more opportunity, and it demands responsibility to help us deliver excellent results. The way that the Opportunity Compact works is the Family Recovery Program was created, as I said, to reduce the length of time that children stay in foster care. When this program was first created, it was determined that children were staying in foster care at least 3.85 years. It was told to the Family Recovery Program if we could reduce the amount of time children stayed in foster care, thereby reducing the cost or the burden to the system, then we in turn would receive 40% of those savings. Now, we haven't had to use that formula to date, but had we had to use that formula to date, we would have saved the state of Maryland over $16 million. And that money would have been used for our funding. Currently, we do have two streams of funding, one through the Department of Human Resources and two through the Office of Problem Solving Courts. Those fund our case management services, our drug treatment, our housing, all the different areas that we need to be addressed in the Family Recovery Program. Those two streams of funding help. The Department of Human Resources, we actually have a 5-year contract with them, which we're in the 4th year of that 5-year contract, and we're in the process now of starting renegotiations for a new 5-year contract. The Office of Problem Solving Courts is a contract that is renewed annually, and it supports 2 of our workers. We do have some future funding needs. We're looking to do some housing development, and we always want to look into ways to have more programmatic development for our clients. As I said before, with the compact, for each child that is reunified with their family, the state actually has the potential to save $30,000 per child. And this number was discovered years and years ago when they were first looking at the Family Recovery Program to try to determine what the impact would be on the community. As I said earlier, each child was remaining in care about 3.85 years at a cost of about $12,000 per child per year, or $35.07 a day. And again, as I said earlier, once permanency has been achieved, FRP could receive about 40% of those savings to continue our operations. Currently, we are able to get children home at about 1 year and about 1 month, so that is saving the state lots of money. As well, we are able to bring home other children who actually were not clients of the Family Recovery Program, but their parents are clients, and as a result of the main child coming home, then those other children are able to come home, and that helps our savings as well. So in order to create excellent partnerships, you have to follow a specific path. And when the Family Recovery Program was started, we followed this path, and I, as the director now, also continue this path. First, you must identify a need. And you can't just say it kind of casually. You have to really, and I really like how Sid and the other gentleman that spoke, Phil, talked about being able to identify your need. Once you identify the need, then you determine a leader who can assist with that need within an agency. Now, that can be challenging sometimes because those leaders are not always very evident. So you may have to do a little research to determine who really is the decision maker in the agency. Third, you would set up a meeting to introduce to your current partners. So one of the things that we do here at the Family Recovery Program is we have a meeting called FRP Stat. Excuse me. And that meeting is held quarterly. And in that meeting, all of our current partners attend, and any new partners that we'd like to have participate with us, they're asked to attend that meeting also. Within that meeting, we talk about all of our statistics, all of our successes, all of our challenges, and people are really able to get a good picture of who FRP is. After that, you must be able to show your results. You can't just generalize and say what the program is doing. You have to have some sort of computer system with data mining capabilities that really allow someone on the outside to be able to determine if the program is being effective. Fifth, you have to be able to show that you can make a difference. Can this Family Recovery Program change the trajectory for children? You have to actually make them want to be on your team. Find ways to make your program seem like such a benefit to the community that they really want to be a part of your team. You must share informative program materials. And one of the things that we really enjoy here at our program is we like to invite them to an event, perhaps graduation. We have graduations probably 4 to 6 times a year sometimes. And we make sure that public officials are invited and just members of the community. And most of all, you have to remember to stay in contact. You can't just call them once. You have to continue to call them and continue to invite them to events. There are 2 important marketing ideas when you're thinking about keeping your program afloat and making sure your program is sustainable. You have to think about 2 things. First, you have to think about how you market the program to your clients, and then you have to think about how you market the program to your potential partners. The 4 Ps are marketing strategies that we employ here at the Family Recovery Program to ensure our continued success. First, we have to think about our product for our client. Is it effective? Is it innovative? Is it time sensitive? Is it client centered? So we've really reviewed all of our systems to ensure that all of those 4 things that I've listed there are important and in place. Secondly, the place. Where are you located? Luckily, we at the Family Recovery Program are located directly across the street from the courthouse. So we're very centrally located, convenient to mass transportation, and we have very convenient hours. We're open almost 12 hours a day. Promotion, make sure that we have very interesting brochures. Make sure that you involve the clients in public speaking, that you as a staff visit the hospitals, social service offices, legal providers, and make sure that the clients are excited about the program and they're speaking to others about it. And lastly, remind everyone that this is free for clients. They have to put nothing out of their pocket. They just have to be willing and come. The next set of marketing strategies revolve partnership marketing strategies. What do you do to create a buzz amongst different organizations in your community that they, at least as I know Phil talked about earlier? First of all, you have to make sure that you have a product that is relative. Is this something that is going to save the city of Baltimore, the state of Maryland, or whatever your state is money? Can you show good results? It's very important. No one wants to fund a program that cannot show results. Place. You have to encourage people to come and visit your office. Show them how the clients use the program. I know here one of the things that works really well for us is we have a computer center. So many of our clients they come in during the day, they get on the internet, they look for jobs, and when people come and visit, they actually see the clients meeting with the case managers. They may see them in group. They may see them on the computer. So they actually see that the Family Recovery Program is a place where things are happening. Promotion with your partners. You have to create exciting and informative brochures. I have one set of brochures for our clients and another set of brochures for our partners. 2 different target audiences, 2 different types of information. Within the promotion, whenever I go to speak somewhere, I always ask the client to come with me because I can tell the story of the Family Recovery Program, but the clients tell it better. When I go to visit hospitals, when I visit any of the legal providers, I take the clients with me to make sure that their voice is heard. When you're talking to your partners, that same thing must be understood. When you're going to meet with them, talk to them, take the clients with you. Allow the client's voice to be heard. And lastly, under price, just make sure that your prospective partners understand how their support can allow for program sustainability. It's a good thing to talk about your budget information before their support and after their support. Actually have your numbers available and handy so that people can see the benefit of the program. Getting those commitments. What do we do to get those commitments? Again, we have 4 additional Ps that really help us guide our strategies when we're trying to get the commitments of different partners. The first is persistence. When I identify someone that I want to work with us, an organization or a foundation, I send personal notes to them. I send them program brochures. I have things that the clients have written about their experience in the family program. I have short video clips that I've taken on my cell phone that I've actually shared with some of them when clients aren't able to attend. The second is positioning. That really refers to how these partners are going to think about the program within the larger arena of human services. When you talk about your program, you can't just talk about the benefit that you're having to the clients. You have to show, as Sid talked about earlier, what is your benefit to public safety? How are you changing what's going on within the criminal arena, the educational arena? Show the program in a larger perspective. Thirdly, you have to have a plan. You have to have a sound, organized plan in place for their involvement. You can't just say, come out and help. We really need your help. You have to be able to very clearly and specifically show them with their help, this is what it is we plan on accomplishing. And the last thing is persuasion. You have to let the work speak for itself. And just make sure any questions that they have or any information that is needed that you're able to provide it in a timely and organized fashion. So some of our partners here at the Family Recovery Program, as probably is the same for many of you all, we have the DSS, which stands for our Department of Social Services. We have the Office of Public Defenders, or OPD. We have children's legal providers. We probably have about 10 different legal providers that have participated over time with us. We have judges and masters. We have the entire juvenile court, and we have DSS Legal. And of course, at the center of everything is the Family Recovery Program. Each of those different partners has a role, and they are all included in a policy team that we have here at the Family Recovery Program 4 times a year. Each of them are invited to come in, and they help guide us and help us to determine the direction of the program. And with their buy-in, they help to continue our sustainability as well. In 2008, we were evaluated by NPC. I think either Phil or Sid may have spoken of them earlier. And their key findings from our evaluation were that children who came to the Family Recovery Program actually spent less time in foster care. Those children were spending 252 days compared to 346 days for children who were not involved in the Family Recovery Program. There is greater reunification. Those families who were involved with the Family Recovery Program were 1.5 times more likely to be reunified than were non-FRP families. There's more treatment completion, and of those families that reach permanency, our parents were twice as likely to complete treatment than any non-FRP parent. Our parents had more time in treatment. Our parents are actually spending 138 days in treatment compared to only 82 days for those who are not involved in FRP. And the biggest part of the whole evaluation was that they determined that FRP did have a reduced cost to the child welfare system. Families in FRP actually use those services less, and the total net cost savings per year was $1 million or $5,000 per saved family, per served family. So even though this was conducted in 2008, we still continue to watch these same key points. We watch these numbers, and we make sure that even though this happened in 2008, we are still a relevant program. Our clients are still spending less time in foster care. We still have great reunification rates. We're still seeing more treatment completion, more time in treatment, and reduced costs to the child welfare system. Currently, we have about an 82% permanency rate, which means that 82% of the children that have been referred to the Family Recovery Program have either been returned to their mothers and fathers, they've gone to another custodian, or they've been adopted. So our children are getting out of the system, and they're staying out of the system. In conclusion, our programs, all of our family recovery programs across the board, can be sustained first by sharing our successes, secondly by creating opportunities for partnerships, as I spoke of earlier, and being actually able to be creative, especially when faced with challenges, and then seeking creative funding strategy, as I suggested earlier with the Maryland Opportunity Compact. So that actually concludes my presentation. I thank you today for listening to me talk about my program and how we are handling sustainability. I've attached my contact information, my phone number, and my email address, so please feel free to contact me. We are a peer learning court, and we do allow visits and conversations with us regarding our processes and procedures, and we'd love to help any group that we can, and we also appreciate the opportunity to learn from others as well. So thank you so much for this opportunity to speak today.
Thank you so much, Jocelyn. And I do want to give 2 plugs here. One, here is an excellent article written about the Baltimore City Family Recovery Court. We've provided the link there. You can take a look at that. It's entitled Show Me the Money, Child Welfare Cost Savings of the Family Drug Court. And the link's there below where you can download a copy. Also, again, thanking Jocelyn and congratulating her on becoming a peer learning court. I'll talk about that program in just a moment. We did have a question that came in, Jocelyn, for your program, and it was with regards to, and I think a very key sustainability strategy really is, again, about having those good outcomes. And does that good outcome start with engagement and retention of clients? If you're getting clients in the door and you're keeping them, then we're hoping they're staying longer in treatment. They're having a better chance of reunification, which leads hopefully to cost savings. And you talked about those innovative engagement and retention strategies. Can you just describe some of those strategies a little bit more for the audience?
Yes, I can start with the re-engagement strategies. As I said earlier, we do have a re-engagement specialist as a full-time employee who every day gets a list from our case managers of those clients who have not contacted the office in about 5 to 7 days. The case manager, of course, makes calls daily to those different clients to see if they can come out or if there's some other challenge that they're facing. But when they can't get them, the re-engagement specialist is notified, and she gets in a car and she travels all around the city of Baltimore looking for clients. We use client information. We use information from their families and friends, and we try and locate them. And once we do locate them, we give them bus tokens, and we give them encouragement and love to try to encourage them to come back into the program. So we spend a lot of time and energy in re-engagement. In addition to that, we also have a parent locator through the courts that is a court employee who, when our clients are also not found, she actually does the same thing. She goes out and she tries to locate the clients, and she serves them when they've missed court hearings, and she encourages them to come back as well. So we really use, one, our employee, the re-engagement specialist, and two, the parent locator, which is paid for by the court system, to make sure that our clients don't fall through the cracks. Our engagement strategies are really key, because when a person first comes into a program like this, they really don't know what to expect. They don't know what's going on. It's a lot of people walking around, and it's just really an environment that sometimes can be overwhelming. So the peer recovery advocate is key there. The case manager does an excellent job introducing the program to the client and giving them information about drug treatment, but the peer recovery advocate is the person that just can kind of sit beside the client and say, you're not going to be here too long. When you go to treatment, this is what to expect. You know, they really give them a different perspective on the entire treatment arena. And this helps them to really not be so afraid anymore. Additionally, we have a court coordinator, which is a part of our grant, that actually goes to court every morning and looks for people who may be interested in joining the family recovery program. He's an integral piece of helping to create just that calming effect when you first come in. Here's a friendly face. Here's someone that really just cares about you, and they're just offering you the opportunity to be in a program that's going to improve your life. So between the court coordinator and the re-engagement specialist and the parent locator and our peer recovery advocates, we spend a lot of time and energy on trying to make sure that our clients get hooked in and get connected, and then staying connected, because it's one thing to get them in, but it's another complete thing to make them stay here and then to have them graduate.
Thank you very much, Jocelyn.
So
I know there were a few other questions that came in about the Baltimore program. We do have the Family Drug Court blog that we can post. If you have additional questions about Jocelyn's program and you'd like to keep this conversation going, you can either email those questions to us or continue to submit those. We'll make sure that Jocelyn gets those, and we'll post those to the blog so we can continue the conversation after the webinar. You also have Jocelyn's contact information, and you can email her directly or email us, and we can get in touch with her, as I'm sure many of you would like to learn more about the Baltimore program. Let's talk about next steps here just for a moment, and then I'm going to provide you with a few resources. Next steps, I think from our perspective, is to be, first of all, clear about the outcomes that you're trying to achieve through your family drug court, and be clear that the stakeholders or those outcomes are shared with your stakeholders, that those outcomes are shared outcomes across treatment. It's not just about improving treatment outcomes, but it's about improving treatment outcomes for families involved in the child welfare system. It's not just about improving child welfare outcomes, but it's about improving outcomes for parents in the child welfare system with a substance abuse disorder. So in other words, making sure you're clear about the outcomes you're trying to achieve, and then be clear about the activities that you're putting in place to achieve those outcomes, and that you know which activities are achieving better outcomes and what the cost of those activities are, and being clear about those costs. Using the simple arithmetic that Sid talked about can be very dangerous, so being clear about what are the differences between startup cost and real cost, and being able to take those startup costs out so that you're not doing the simple arithmetic and coming up with very high client cost numbers. So being clear about your costs, being clear about the cost of business as usual and how you compare to those and how your outcomes compare to business as usual. Looking at your outcomes and compared to the larger system is very important. Recently we've been contacted by a state where their family drug court outcomes graduation rates look not quite as good or worse than the adult drug court outcomes. Well, let's be clear about our population, about our baselines, and making sure that we're being compared apples to apples and not apples to oranges. And so be clear about your own baselines, be clear about your own population so that you can make the case and market to those very important stakeholders. and then be able to pick the best bets. Who was most likely to fund your program or those activities within your program. We talk about the good, better, and best models, breaking out your costs. You have these in your handouts. I won't go through each of them, but you can take a look at those. And again, we're here to help you with this. Please feel free to email us at FDC@cffutures.org, and we'd like to help you put together your cost with your sites and help you with sustainability planning. Again, another good resource is in PC Research. There's a couple cost studies here and a link below where you can download those articles. They're showing very good cost savings across the country. Your family drug court, assuming you're doing good practices and having good outcomes, may also show very good cost savings, and we'd like to help you do that. Again, telling your story is important. As Jocelyn talked about, clients do it better than us. And there's back there with that resource as well. I'm sorry, I flipped there too quickly. So telling your program story. This is through the CDC or Department of Health and Human Services publication. It's a few years old now, but still a good one. Again, I wanted to talk about the Family Drug Court Peer Learning Program. These are 5 courts that were selected in September. Baltimore City Circuit Court, you heard from Jocelyn today. We also have Hillsdale, Michigan, which is our road court, Judge Nye, and then Pima County Juvenile Court in Arizona, Chatham County Juvenile Court in Georgia, and Jackson County Family Drug Court in Missouri. These courts are willing to share their resources with you, their policy and procedures, their handbooks, how they're sustaining their programs, whether they're engagement activities, how they're serving children better. So if you'd like more information about our Peer Learning Court program, or you'd like to visit one of these, or you'd like to have a phone call with one of these sites, please email us at peerlearningcourt@cffutures.org. We'd love to share their information with you. I talked about this before, but again, the Family Drug Court blog. Please visit this and keep the conversation going. It's familydrugcourts.blogspot.com. And again, our webinars are available for download. This year we had 8 webinars, and they're all available on our website. You can play them back and download the materials that went along with them. We hope to see you in 2013 when we have a new and expanded round of webinars. If you're interested in a certain topic, email us. Let us know what that topic is, and we'll try to incorporate that in our 2013 planning. You can email us again at fdc@cffutures.org. Again, I'd like to thank our speakers, Stead Gardner and Jocelyn Gaynors, for presenting today's webinar. I'd also like to again thank the Office of Juvenile Justice and Delinquency Prevention for supporting this webinar. And I'd like to thank you, the participants, for joining us today. Please take a moment to complete our evaluation. We do take your feedback very seriously and like to improve upon this process in 2013. So thanks again for joining us, and thanks for the work that you're doing with children and families. And this concludes today's webinar.